Good evening and welcome to MG Wellness Ask a Doctor. We are live here from Indianapolis, Indiana, and let me bring our cameras up. And over here are the wonderful Dr. John and Dr. Kelly. Dr. John, Dr. Kelly, what is our topic tonight?
Smoking and cancer. It's a hot topic. We've had a lot of incredible conversation leading up to this event.
Absolutely. People get very fiery about this topic.
Fiery, smoke. Oh, neat.
Hey, every once in a while, someone's got to have a pun.
All right, so let's start with some of the very basic questions. We just have some beginning. And again, let me do a little bit of housekeeping just to make sure that you know that you can at any point ask us questions. And you can do that by, let me get to the right slide there, support@mgwellness.org. I'm going to be checking that email a couple times over the next hour, as well as comment right here on Facebook Live. And I will also be checking, there may be somebody there, we're for the first time live on YouTube at the same time, simulcasting both places on Facebook and on YouTube at our MG Wellness channel there on YouTube that we're just getting ready to put more and more topics of information on. So again, ask a question anytime. We'll be curating those and putting those between so the doctors can answer that. But as we get started, we have a few questions that we kind of prime the pump here. And the first one is, let's start by what cancers are specifically caused by cancer or by smoking?
There are lots of cancers that are caused by smoking. We talk most often about lung cancer, don't we?
But it's amazing how many of the most common ones are.
Yes. So I'm going to list several of them. Mouth and throat cancers, larynx, your voice box, can develop cancers. Acute myeloid leukemia, a blood cancer, can be caused by smoking. Kidney cancer, cervical cancer for women, bladder cancer, esophageal cancer, trachea cancer, liver, stomach, pancreas, colon, and rectum. The lung cancer, however, of all the cancers, there are over 100 different types of cancer. Of all the cancers, lung cancer is the leading cause of death in men and women, period.
Yeah, it has surpassed breast cancer as the leading cause of death. And it's an interesting reason why that's happened.
Go ahead and explain.
So we've talked a lot about this the last few days, that it's interesting that although the number of smokers hasn't necessarily gone up over the last few years, the number of lung cancers has gone up, as well as the number of lung cancer deaths. And it appears it's because of what has happened to cigarettes over that time.
Yes. So the first warning about cigarettes from the Surgeon General was in 1964. And so when you read on this topic, you'll see that year talked about frequently. And that's because that was when the first warning came out about the challenge with smoking and the risks associated with it. But what has happened is, even though fewer people have been smoking since the 1960s and 1970s, the rate of lung cancer has increased. And so a couple of reasons for that. Number one, cigarettes are made differently. They have filters on them now.
Which you would think that filters would make it better.
Right. I think that's what everybody does think. But there's a theory, we don't know exactly if this is plausible or not, but there's a theory that because of that filter, you have to inhale so much more deeply, and that is driving the toxic chemicals deeper into very, very fragile lung tissue. So that's one theory.
And it's not able to get cleaned out.
Correct. Yeah. And then the other theory is, and I think that this is something that is actually known, not just a theory. There are so many more chemicals added to cigarettes than there used to be in the 1960s and 70s.
Do you think part of that is because of fertilizers and pesticides spread on the tobacco?
Probably. I mean, it's we talk about this frequently. Farming techniques have changed dramatically to increase what we yield on each farm. And so it's been estimated that there are 7,000 different chemicals in tobacco smoke, 70 of which have been proven to be cancer causing.
That's pretty amazing. And that doesn't mean that the other 6,930 are fine. A lot of those just haven't been tested fully.
Right, exactly. But we do know that 70 have been proven to be cancer causing. So that is one of the reasons that I think there was a comment on the feed during this week about somebody saying, well, my mom, is 70 years old and has smoked all of her life and she's fine.
But that's just statistics.
Yes.
When you talk about risk, whether you're talking about risk of heart disease, risk of cancer, risk of walking across the street, just because there's a risk doesn't mean it's going to happen.
Right.
It just means you have a higher chance compared to someone not doing it. If you're crossing the street without looking and the other person's walking down the sidewalk, you have a higher chance of getting hit by a car crossing a street without looking.
Right. So it's just...
Doesn't mean you will.
Right. So it doesn't mean that everybody that smokes is going to get all the things that we're talking about, but the risk is certainly dramatically increased. So I hope that answers some of those questions.
So let's jump into other types of tobacco. So chewing tobacco, obviously, does it change for different types of, whether you're smoking cigars or even other types of smoking? Let's talk cannabis or other things like that. How does that change the risk of causing cancer?
So with cannabis,
The data just not known.
we just don't know yet.
There just isn't enough.
It hasn't been studied enough. Cannabis is obviously a very, very hot topic. And there's just so much research that needs to be done to answer some of these questions. Not only what could be the benefits of cannabis, if there are, but also what are the risks? So we just don't have those answers yet. In terms of chewing tobacco, there are certainly increased risks of mouth and throat cancers, pancreas cancers, and esophagus cancers. So while chewing tobacco doesn't spread the smoke into the lung,
It still has risks.
right, it still has cancer-causing agents in it that affect organs in this region and then in the upper belly where the pancreas is.
And with cigar smoke, one of the differences is, in general, most people who smoke cigars aren't smoking the volume or the pack years that someone is who smokes cigarettes. Smoking cigars does put people also at risk for external oral cancers.
Yes, on the lip.
But let's talk about what a pack year is.
Yeah, I was just going to explain that. So we quantify how much somebody smokes by a measurement called pack years. And it's very simple. It's not complicated, but it is literally taking the number of years that someone has smoked times the number of packs that that person smokes per day. So if someone smokes a pack per day for 30 years, that is 30 pack years.
Or 2 packs a day for 15 years is
30 pack years. So, and 30 pack years and above is considered heavy smoking. That's a heavy smoking history. We'll talk a little bit about why that matters later. But that is how we define or quantify someone's risk, is through pack years.
So let's go on to some of the other questions we have starting. And again, reminder, I'll bring that up again, that you can ask questions. You can do it privately by emailing at support at mgwellness.org, or you can comment here at Facebook Live, or I'm going to be jumping over here to YouTube. If you happen to be watching on YouTube, you can go to YouTube. I encourage you to do it. Please follow us. We just launched our channel there. You can jump in. You can search MG Wellness, and you can see the first 3 videos that we've posted over there. We're going to be posting a lot more content there at our YouTube channel. As we're looking and waiting for some questions to come in, we do have a few more of our beginning questions to keep going with. And the next question I kind of wanted to bring up was, what is secondhand and third-hand smoke? I've heard of secondhand. Third-hand was a new one. What is that?
So secondhand smoke is when somebody in the home is smoking, or somebody in a restaurant or bar
Right, and you're
is
sitting at a
smoking,
bar and someone's smoking near you.
and you're inhaling.
That's the exposure. Yep.
You're inhaling 2 things. Number 1, you're inhaling smoke that is coming off the end of that cigarette, but you're also inhaling smoke that is coming out of the smoker's mouth.
Okay, that's gross.
I know, but I'm just
Sorry.
saying. That's what it is.
Never thought of it that way before. Thanks for making it real.
Yes. So, third-hand smoke is when the surfaces of things within the home or clothing or hair have toxic chemicals from smoking left on them. So it's residual chemical content
And
from
that still
smoking.
is risky.
Yes, and in fact, there have been studies that have shown definite increased risk with not only secondhand. That's very, very clear. There's lots of data on that, but with third-hand exposure as well.
So the big thing out of that is smoking basically puts you at risk.
Well, being around someone who smokes,
So smoking outside,
it decreases the secondhand exposure,
but it still brings in the third
but it
hand.
still brings in third-hand exposure into the home.
So let's think about this. So are there any studies, and this is outside of the questions that we had set up, but that show exposure for like young children that are exposed to second and third hand smoke but never smoke themselves, or
Oh, absolutely.
how does that change risk as it goes on if they develop and start smoking, but they had the first 18 years of their life they were secondhand exposure, then they started smoking themselves? Does that increase? Does it compound as you keep adding things to
Yes.
it?
Yes, it does.
Yeah, and children who are exposed at a young age, especially to second and third hand smoke, are put at high risk for lung infections and reactive airway disease, asthma,
Yes.
flu, ear infections.
More ear infections, more colds, more time out of school. Those things are definitely demonstrated.
and well documented.
Yeah, that kids are at increased risk for all of those things. It's even true that children that are exposed to second and third hand smoke have an increased risk, babies have an increased risk of sudden infant death syndrome. And so there are lots and lots of risks that are associated.
Right, and it starts earlier than that.
Right.
Remember, part of our training was OBGYN.
So
Even
we
though-
know about pregnancy risk.
And smoking during pregnancy has been related to many things. To start at the very beginning of pregnancy, it's related to ectopic pregnancies.
Yes.
People who smoke have a higher rate of ectopic pregnancies. What else? Low birth weight babies? No, that doesn't mean smoke on purpose so you deliver a smaller kid, because that kid has problems.
Yes.
I have actually heard people say that.
Yeah, so don't do that. It also can mean preterm delivery, early delivery, where babies may have to stay in the hospital longer to grow and get bigger and stronger before they can go home. And smoking has also been associated with an increased risk of birth defects.
Right.
So there
And
are,
that's probably from increased carbon monoxide exposure as well as decreased oxygen
yes,
going across the placenta.
yes. So there are lots of risks that can occur during pregnancy with
Which
smoking.
that is about as early as you can expose a kid.
Yes.
So Sabrina asks, so if I smoked a pack a day for 15 years but quit 19 years ago,
Good for you.
what risk of cancer would I still have?
So
Great question.
That is a great question, and your risk is not as high as someone who smoked 30 pack years. First of all, because what you said, you smoked for 15 years, a pack per day, and quit 19 years ago. Statistically, by the time you hit 20 years past smoking, your risk of cancer is the same as someone who never smoked, as well as your risk of dying from other other smoking related diseases by 20 years after quitting smoking is back to that of someone who's never smoked. So great for you.
Yes, that's a wonderful question, and that's one thing that we do want to encourage people with is that yes, smoking is very addictive, and I know that there are many people who say if you've never smoked, you just don't understand. And that is true. That is true of a lot of things in life. If we've never gone through that experience, we don't fully understand, but we do know that there is tremendous benefit available to you and to your family and friends if you engage in that really, really difficult thing of quitting smoking. And we had many people make comments about how they have struggled through that and conquered that quitting of smoking and how they feel better. And so we want to encourage the rest of you as well.
One of the problems with smoking and quitting is kind of a two-prong effect. One is obviously the nicotine addiction. By 3 or 4 days after your last cigarette, the nicotine's out of your body, and that's when the cravings really hit. But on top of that, it's also a muscle memory. You get agitated, you'd want a cigarette. You have breakfast, you want a cigarette. You take a coffee break, you want a cigarette. You have to break that muscle memory as well as get over the nicotine addiction.
Yeah, your brain gets used to that. It's just like giving dogs a treat when they get in their little kennels. Well,
Pavlovian response.
Right. It's the same thing with us, that we train our brains to have a certain response. And so changing that is very challenging.
And that's one of the reasons why smokers will often gain weight, because they replace the cigarette with food, which is not necessarily good either. There's a study done in the cardiology literature that shows that smoking a pack per day and gaining 20 pounds have the same risk.
Yeah. So it's a tough, we are not here to say that it's an easy battle.
Not at all. Not at all.
But we
are here to say, especially from looking at the cancer risk,
there's benefit.
There's definitely a benefit to fighting that battle and powering through.
Yes.
So let's think through what are ways and successful ways to actually quit smoking. For those who have started, it's certainly addictive. What are we hearing, and what's the research say about ways to effectively quit smoking?
One thing, and Dr. Kelly has tons of information, but one thing to say is that especially when you're talking about quitting smoking, there is not one tried and true method that works for everyone.
Yes, very true.
No one can say there is. If they're peddling that.
Yeah, it's just not true. There are lots of things that are available, but you have to figure out for you what is going to work. So I'm going to go through several things, and you jump in whenever.
Oh, really?
Oh, yeah. I'll let you talk tonight.
Oh,
so the most important thing that has been shown, no matter what treatment has been used, is psychologically gearing up for that quit date. If people who are trying to stop smoking, if they don't pick a quit date, a target date.
And one close to where you are.
Right, not a year from now.
So you don't convince yourself otherwise.
Right. But within the next month sometime, if you pick a quit date, you have a higher success of achieving your goal if you focus upon a date. So that's number one. There are medicines that are available, and there are non-medicine treatments that are available. And certainly, I would encourage everyone who's trying to battle through this to attempt and engage in the non-medicine ways because there's so fewer side effects. There are
Right.
lots of side effects associated with the
Yeah,
medication.
And some people that I've seen, and obviously there's lots of people going through this battle, but I've seen a lot of people actually end up using more nicotine in their nicotine replacement therapy than they were getting from the
smoking.
cigarettes in the first place.
Right. So let's talk about the non-medicine treatments because I think the data is very compelling and it's encouraging. Acupuncture is something that has been shown to be very effective in helping people stop. I'm not saying 100%. And
Nothing
I'm
is
sure
100%.
there are some of you here that would say, I tried it, it didn't work. Okay.
And understand,
It's going to be true of all these.
it's going to be true of all of them. And even the most effective medical treatment at 6 months is less than 20%, meaning if 5 people stop and they're using the medicine, 4 of those people will be back smoking by 6 months.
Yes. So,
So we're not talking 100% effective, 80% effective.
right. So acupuncture, and there are people who are specifically trained in acupuncture smoking cessation. And it may require repeated visits for acupuncture.
You can always try like stapling.
Nice.
Sorry.
Nice.
Just that.
Another option is hypnosis, and that requires repeated visits, but it has been shown to be helpful, especially when you pick a quit date. One of the newest kind of things, because we are so Facebook, Instagram, YouTube oriented in this world.
By the way, follow us on all of it.
Yes, please follow us at MG Wellness. So one of the things that's been proven is that Facebook support groups,
Help.
yes, and there are apps that are available to helping quit smoking that create community as well.
And
the same
it's like
kind of
what
idea.
we talked about last week, and we talk about it actually in our course on chemotherapy, that community is key.
Yes.
And I truly believe that's part of the reason why acupuncture and hypnosis work. Obviously, there's other reasons, but you're actually dealing with an individual in a relationship, helping you, supporting you along the way.
Yes, guiding you through that process.
Right. It's like
Yeah.
going through AA and having a sponsor.
Yep.
Having community helps you with any of these things.
Yes, because when you have those cravings, you have a community that you can reach out to and say, man, this is really tough right now. And there are people available there to support. So that has actually been shown in scientific studies
Yeah.
to be very
From the
helpful.
University of California at San Francisco.
Yeah. So the 3 medication categories, people talked a lot about these in the comments. Chantix is something that has been shown to be more effective than the other medications, but by more effective, we mean in the 15 to 20% range. We don't mean 100% of the time. And that's a medication that can be taken at least for 12 weeks, and some people take it for 24 weeks. Some of the things to be very cautious of with Chantix is that sometimes it can cause some anxiety and angry thoughts, and sometimes it can cause some really weird and odd dreams. And so some people are kind of nervous about
Is
that.
that like talking about? Oh, what do you forgot?
No, don't say it. Chantix has success rates.
Shut up before I even got to say anything.
Yep. It has success rates, but it also has lots of side effects. Okay. And then bupropion is actually an antidepressant.
Right. It is one of the non-serotonin reuptake inhibitor antidepressants.
Yes. And it has been shown to be helpful, but again, helpful is the 10 to 15% range.
Right.
And then nicotine patches are the last
Well,
category of
nicotine
medication.
patches, nicotine gum,
Yes.
nicotine sticks.
Yes, nicotine in lots of substitute forms. So those are some treatment options that are available.
So of all the options and treatments, what health benefits do you see the quickest or long term when you actually stop smoking?
So-
What are the things that happen, and how quickly do they happen?
Yeah, that's a great question. And, obviously for what we're talking about today, cancer and smoking, it literally takes to get back to the same risk as someone that's never smoked 20 years. But benefits begin immediately. You will find some surgeons, especially if you're talking about vascular surgery or plastic surgery, will refuse to do
Certain
surgery
procedures.
for at least 30 days. So within an hour of your last cigarette, your heart rate starts to drop, your blood pressure starts to go down back towards normal. So that means every time you smoke, your heart rate goes up and your blood pressure goes up because of the nicotine. By 12 hours, your carbon monoxide, which we've talked about earlier, which carbon monoxide is deadly, but carbon monoxide goes up in smokers, and by 12 hours, that's gone. By even 1 day of quitting, you've already started to see a decrease in your heart attack risk. That doesn't hit really big numbers until a year out.
But it's pretty remarkable that just 1 day of quitting, you can begin to see a decrease in heart attack risk for smokers. 2 days of quitting, the sense of smell and taste begin to heal. It's not all healed that day.
No, because remember, taste buds are nerves. Nerves take a long time to heal. But the fact that it's that quick is pretty amazing.
Yes. 3 days of quitting, which Dr. John mentioned earlier, the nicotine level is gone, and it's back to zero in your bloodstream. And so that's when the cravings hit. That's usually when it's really, really rough, and that's when you need that support to get through it. 30 days after quitting, you can already begin to see improved lung function, where you have less coughing, less shortness of breath, and you can do more things athletically, walking, running, whatever that might be.
By 9 months to a year, your lung infections, your pneumonia, those drop significantantly. As we talked about a minute ago, by a year, your heart attack risk goes down by half. That's
pretty significant.
That's amazing.
5 years out, arteries that have been previously damaged by smoking have now returned to looking like arteries that are those of a non-smoker. And the risk of blood clots decreases by the time you're 5 years out from quitting.
So that's one of the reasons you'll hear, as a woman, if you're in your 30s, your OBGYNs won't give you
Birth control pills.
estrogen-containing birth control pills because the combination of the estrogen-containing birth control pills with smoking shoots your risk of blood clots up like crazy.
Up dramatically. 10 years after quitting, the risk of lung cancer decreases by 50%, by half, which is wonderful. And mouth, throat, and pancreas cancers begin to decrease as well. 15 years out, risk of heart disease or heart attack is the same as that of a non-smoker.
And by 20 years out, your risk of dying from cancer that's related to smoking, or your risk of dying from any other smoking-related disease is back to the same as if you've never smoked. I think one of the most profound things I ever saw was looking at the lung tissue of a smoker in gross anatomy lab. It's unbelievable the difference between a smoker's lung and a non-smoker's lung.
It helps to understand why people who smoke for a long period of time with a lot of packs per day have great difficulty breathing when you see things like that in anatomy classes. So the point of this timeline is to show that there are immediate benefits from stopping smoking.
Absolutely. And
Doesn't mean it's easy, but immediate benefits.
but there are immediate benefits. It's not like you have to wait 20 years to get any benefit.
Right, correct.
So what is what are some of the ways that you are encouraging patients that you're seeing that are smokers? What are you seeing that's being successful? What are some success stories that you're seeing from that?
Honestly, the biggest thing is support groups.
Yes.
I truly
Support.
believe it.
Support not only in the name of a Facebook group, but support from other family members, support from kids who want their parents to stop smoking because maybe they just don't want them to be around the grandkids with the smoke.
Yeah, I could give hints to people out there how to convince your parents to stop smoking by the tricks my brother and I used to play on our parents when they were still smoking, despite one being a cancer surgeon and one being a OBGYN nurse.
That was back in the day when a lot of people
Absolutely.
smoked.
But
What did you do? Reveal.
so we did fun things like filling the bottom of all the ashtrays in the house with just a little bit of water. So they put the cigarette in and it fizzled out. The other good one is, you have things around your house, especially back then when you're growing up as a doctor's kid, where, you had syringes and needles, and we could fill it up with Elmer's glue and then inject Elmer's glue directly to cigarette packs.
Things that you perhaps should not try at home. Yep.
But effective.
Yes. Yes.
All right, bringing up a comment from Sabrina. She said, I had to take it 15 minutes at a time, knowing the craving would begin to decrease after that. So when a craving would hit, I would set a timer and talk myself through them.
Wow.
But I think one of the things that is interesting is what you said is that there is not just one way to do that. The only way effective is trying something. And if that
Yes.
doesn't
Absolutely.
work, try again and just keep trying. Let's talk about those who are active and already have been diagnosed with cancer and maybe they're still smoking. What do you see with that? I mean, I've met a couple people in my lifetime that are, have lung cancer. It's most likely from their smoking, and yet they're still smoking.
Yes.
Well, we've seen people with laryngeal and esophageal cancers, especially laryngeal, where they've had to take out their voice box and
put in
airway.
their airway here. This is how they breathe.
that they'll smoke through that.
Yeah.
So smoking decreases your immune function, not only just in the lung, but in the lung it does it because there are these little tiny hairs, especially in the upper airway, that are part of cells that form mucus, and these little hairs push the mucus back up.
To get it out of your lungs.
And smoking destroys these cilia, these little hairs. And so things get caught down, and the immune system get caught down in the lung, and the immune system's worse. But also, one of the amazing things is that smoking affects your immune system by affecting your gut.
Yes. So we've talked about the connection between gut and your overall health at nearly every session that we've done. And it is also true with smoking that smoking makes the gut dysfunctional.
Right.
And so we know that 60 to 80% of the immune system in our bodies is located within our gut. And so if we do things that make our gut sick, then we don't have a properly functioning immune system. And so not
Then it
only
makes tolerating treatment of cancer much harder.
Yes. So not only do we need the immune system to hopefully not ever get cancer, right? Because our immune system is going to try to kill those cancer cells. So we need a properly functioning immune system for that. But let's say we've already been diagnosed with cancer, then we need an immune system to help us tolerate treatment. Whatever that may be, surgery, radiation, chemotherapy, all the things that are used to treat whatever cancer you may have. And if you don't have a properly functioning immune system, treatments are so much more difficult to tolerate.
Absolutely.
All right, let's just do a little bit of housekeeping while we come to some more questions here. One, you can be asking questions at any point, obviously, here in the comments. Thank you to the first couple people I've seen over at YouTube who are watching. If you want to leave a comment over there, I'm checking in over there about every 2 or 3 minutes. And then, of course, here on Facebook Live, we would love to have answer any of your questions you may have, or email us at support@mgwellness.org. It's coming very, very soon. I believe probably tomorrow we're going to be sending out our first newsletter. How do you get the newsletter? Well, you sign up for it, of course, and you go to mgwellnessnewsletter.com and you put your email in, and we will send you that newsletter as we are beginning and growing and putting some of our products out, because we're going to be soon launching our first course, and we want to make sure that you know about that, as well as knowing about future dates of Ask a Doctor. We'll talk about that a little bit later. Dr. Kelly, Dr. John, when it comes to quitting, let's not even saying let's start with not starting smoking. What are you finding are ways, how are ways for people to encourage people not even to start, and specifically at a young age? Certainly it was going down for decades, but I believe it's going slightly up again, smoking in the United States here.
It is. Smoking is a learned behavior.
Absolutely. And it's often associated with peer pressure.
Yes. So, number one, we have all been raised in a variety of homes where we have developed behaviors, whether that's related to food or smoking or alcohol or drugs or none of that. We have modeled behavior that we've seen.
And so the best way to keep your kids from smoking
is to not smoke yourself.
Right.
And then, just like Dr. John was saying, it is a peer pressure type thing. So as your kids are growing up, always teaching them to make, it's hard,
good choices,
but make good choices in friends, where they may get together and watch a movie instead of get together and smoke. Making those really, really good choices in friends, being involved in their choices of friends. And I know that it's not easy. Parenting is not
tough
for the weak. But that is really, really important, because that's where peer pressure drags kids into habits that are very difficult to break.
Truly know is that the most important place for education isn't school. The most important place for education is the home. And if kids see you modeling behavior that is bad, they're going to follow it. If they see you modeling good behavior, they're going to follow that also.
And if they see you struggle valiantly to stop smoking, that has a deep impact on a kid.
Absolutely.
And so, so we would encourage you again to engage in that battle. Okay.
What about prevention? I know prevention is the wrong term, but the secondhand and third-hand smoke. What are some steps we can take? We can't cut that totally out of our lives. Unless you want to be bubble boy. But we're going to be around that in some ways. But what are some practical steps we can take to make sure that has the least impact on us?
So one of the things that's happened recently in our society, yes, cigarette smoking is a little bit on the rise right now, but cigarette smoking has become more kind of socially unacceptable. People don't want to be around the smoke. And because of that, that tends to have positive peer pressure.
Right. And, if you stay away from establishments that allow smoking inside them,
Yes.
that's a huge step.
Secondhand exposure has decreased dramatically since the 1980s when
Right.
in that time period, so there were some studies that were done measuring the amount of nicotine metabolites in the blood of people who were exposed to secondhand smoke. In the 1980s, over 80% of people who would go, to restaurants and bars and all the places,
Would
the
have
smoking,
cotinine.
right? They would have cotinine, which is this metabolite
Levels
in their bloodstream.
and urine.
Right. And these were non-smokers, but just exposed to secondhand smoke. But in the early 2010s, that number had decreased to only 25% of people who were non-smokers exposed to secondhand smoke. Only 25% had measurable levels of that nicotine product in their blood or urine.
Right. A recent study that came out looking at people under 18, and specifically it looked at people under 18 who had never smoked. And despite never smoking, a third of kids under 18 that were tested still had cotinine in their urine, meaning that there is exposure, but it is not anywhere near the exposure
That it used to be.
that it used to be.
Right. So laws that have made smoking not allowed in a variety of establishments, that is actually protecting all of us from secondhand smoke. It's interesting. This is another statistic that since 1964, when that first Surgeon General warning came out about smoking, 20 million people have died from smoking-related disease.
Right.
And 2.5 million of those are from secondhand exposure.
Right.
Now, I realize 1964 is like a lifetime ago. Good grief, it was before I was born. But,
Really?
yes.
You lied to me.
But,
Kidding.
whatever. We're the same age. But
I'm older.
2.5 million people
Secondhand smoke.
dying from secondhand
So,
smoke exposure.
I think one of the most profound statistics out of all these is what you and I were talking about earlier today, which is if you eliminated all smoking,
If it wasn't allowed, let's just say it wasn't allowed.
and we won't even get into why is it being subsidized by the government, but
It's
if you eliminated all smoking, 1 out of every 3 cancer deaths each year in the U.S. would be prevented. 1 out of 3. That's pretty amazing that
It's shocking, actually. I was reading that statistic over and over saying that is, man, 1 out of 3 cancer deaths could be prevented. Again, not saying it's easy, but man, what an impact we could have if we got that support to get through that challenge. That would be amazing.
Well, we have a couple of questions, and I was waiting for this question, and I was glad. So Janice brought up, I'll bring it up here on the screen. I think the vapor cigarettes have helped increase the smoking. So, and certainly vaping has been in the news.
Yeah.
Even some deaths because of certain chemicals that we have yet to be identified. But don't those cigarettes use lots of chemicals like formaldehyde, etc.? So let's just talk
Yes.
a little general about vaping and that new culture, that e-cigarette vaping culture that has happened in the last decade, I would say, a little less.
so there's no proof that it's safer than cigarette smoking.
Yeah, and there's still so much study to be done on this.
And some of the deaths have been with vapes that were altered in some way. But we just don't.
The amount
Understand.
of smoke that comes out of the vaping e-cigarettes is
Oh, it's
tremendous. And we don't even know the
What's in it?
chemicals that are causing these deaths. We don't even know exactly why that's happening at this point. And we certainly don't know all of the chemicals that are in that smoke.
one of the things that I have pointed out, I'm sure probably far too many times to my family.
Perhaps.
Is that you can actually smell when someone is vaping in a car in front of you on the road.
Yeah, that smoke comes in your car vents.
So you actually get exposed to it.
Right. So vaping has not been shown to be safer, and there is significant concern and valid concern. People are dying from it, and it's unfortunate because I think a lot of teenagers think that this is safer, but clearly not. We don't have any evidence that it is safer, and we're beginning to get evidence that it is potentially very dangerous.
Yeah, it took off amazingly quickly.
Yes. So I hope that through active research and investigation that's going on right now, that
And through education.
yes, that it will be curtailed or not socially acceptable to do that anymore.
Well, and Scott, I want to bring up one of his, Scott Scheid says, don't forget, sorry if I messed up the pronunciation there, don't forget flying on planes too. But certainly things have really changed in society in the last decade, 20 years, and really since the 60s and 70s and the Marlboro Man, and certainly there. But one of the things is, why are some of the things different from the 60s and 70s in cigarettes and smoking than they are even today? What has changed that has made cultural and even for what we're smoking? Is that making a big difference in what's happening in our bodies?
Yeah, I mean, just like we were mentioning earlier, how cigarettes are made now, the filters that, you would think that sounds so protective. Now there's potentially evidence that it's not safer because the increase in lung cancer diagnosis has risen dramatically, despite the fact that it is not, smoking is not as common as it was in the 1960s and 70s. It's also true, I forgot to say this earlier, that the cigarettes have menthol added to them. And that has made it easier, especially for kids,
To smoke them.
to smoke. And so, man, wouldn't that be great if we just took that out of there? It wouldn't be so easy.
Scott, I agree with you so much about airplanes. And yes, I fly. But one of the things I always do, and I have decreased my respiratory illnesses by turning off the direct flow of air onto me on an airplane. Because on an airplane, everything is just recirculated without being filtered. And
So you're getting yucky air blown on you right
whether
above
it's-
your head.
Whether it's someone's smoker breath that they're not smoking on the planes anymore, thank goodness, but whether it's their smoker breath, their cough, their sneeze,
Their flu, whatever it is,
getting blown straight on you.
turn that little vent off. Yes, it gets hot, but just turn it off.
And we have decreased our respiratory illness. And
We don't have evidence, scientific evidence to support that, but it is something that's had an effect, positive effect for us.
All right. Well, if we don't have any last questions, we'll take a few seconds here, but I'm going to turn it over to Dr. John and Dr. Kelly to talk about our upcoming course. We're going to be launching here in the beginning of December, our first course, part of MG Wellness. And can you tell us a little bit about what it is and who are the right people to take this first course?
So we're really excited about this course. This course is entitled How to Live My Best Life While on Chemotherapy. And we're excited about it because we have never been able to find a single source to help patients through all of the steps and decisions and what ifs and questions that they have while they're going through a cancer diagnosis and going through chemotherapy.
And it's not just it's pretty broad encompassing.
Yeah, the courses, yes.
The courses, it talks about what cancer is, what cancer isn't, where the cancer comes from, what chemotherapy is, what immunotherapy is,
Yes, what the risks are associated with chemotherapy.
what the real side effects are,
Right.
how
And
to treat them.
yes, and it gives you sources that you can go to on the internet that are reputable sources to give you valid information. It then goes into medicines that can be prescribed to counteract side effects, as well as natural supplements that have been proven
Evidence-based medicine.
to be helpful in counteracting the side effects of chemotherapy and immunotherapy. We also go into frequently asked questions that we always get asked by patients
And
who are
have for
undergoing
years.
this. And then we talk
Talk about
quite a bit,
exercise.
about
diet.
exercise, nutrition, and de-stressing, how that can have an impact.
And so, who is it for? For people who are taking chemotherapy or immunotherapy, for family members of those people so that they understand what their loved one's going through?
Yes. So I think it's for anybody who's on active chemotherapy or for family members to watch and understand how they can help their family member undergoing chemotherapy. We are launching this in the beginning of December. And one of the things, I know this is an odd thing, but sometimes we struggle to know what to do for someone who's undergoing chemotherapy. So if you know someone who's undergoing chemotherapy, this would be an incredible gift that you could give them to help them be able to live their best life while they're undergoing chemotherapy. And then at the end of that course, we give ideas about how to get on with life and live and get back into your normal activity on a daily basis.
And to stop letting cancer rule you.
Right, exactly. How you can conquer it. So we hope that course will be incredibly helpful for all of you, and certainly reach out to us through our websites and follow that and find out more information about it. The launch is coming in just a few weeks.
And people that go through the course, we want to hear feedback. What's good, what's bad,
Yes,
what
and-
to add, what to take out.
Right. And once you've purchased that course, the course will then be continually updated, and
You'll
will
lifetime
have
access.
you will have lifetime access to the course and all of the things that are modified as we learn more.
For as long as the internet is up.
Which will at least
For a long
last for the next hour. Or so for you to go to mgwellnessnewsletter.com and sign up and make sure you're on our newsletter. That is the best way to stay up to date on information and to learn a little bit more about MG Wellness. Tomorrow's newsletter that will be going out gives a backstory a little bit of why MG Wellness has been founded. It's a great starter to getting involved with this. We have already almost 1,000 people signed up, and if you are not signed up, just simply go to mgwellnessnewsletter.com, put your email in. That's a great help. We have at least one more question that's come through, and we have a few more minutes left if we have more questions. If not, we'll just close off here in a second. But one of the questions that was brought up, let me make sure, get my slides up here, off here, is the risk higher for lung disease with vaping as opposed to cancer? The news seems to talk more about lung disease related to vaping deaths.
Yes, we just don't know. Vaping has not been around long enough to be able to tell that kind of thing yet.
Because it hasn't been studied well enough yet.
Yes, it always, that's how medicine is. Things come about and we don't know the risks, and everybody gets excited about it and everybody uses it. And then all of a sudden, we 10 years, 15, 20 years down the road go, oh, well, that wasn't very safe, was it? And that's kind of the catch-22 that we're in right now with vaping. My suspicion is we will find that there are significant risks.
And one of the biggest issues with vaping and with a lot of these vape illnesses and vape deaths is that it's really easy to alter.
And what do you mean by alter?
To put other things in with the cartridges.
Like?
Anything. That's the problem.
Yeah.
And by doing that, you are getting chemicals into the lung, which is some of the most sensitive tissue. And you're getting it in high quantities in basically a heated or mist or
Moist area. Yes?
no, but
No?
you're getting it in basically droplets where it's easily absorbed by your lung, and causing these damages.
Yeah, the lung is one of the most delicate tissues in the body. The little tiny baby alveoli that are little air sacs that are at the very end of the lungs are
Super sensitive.
single layer of cells and just very, very, very thin and delicate. So you're putting all of these thousands of chemicals into the lung, and that cannot have good effects. But we just don't have a lot of data yet.
Well, for that, I think we're going to sign off. The end of the story tonight is if you are smoking, quit. If you're not smoking, don't start. And don't tell us that just simply the fact that you have one person you know that has lived 122 years and smoking. The fact is you can go blindfolded across a busy intersection and one time you'll make it. But you never know what'll happen.
Right.
So we are certainly glad that you're here. We thank you so much for watching. We will be live next week. You can find that on our Facebook page, MG Wellness. Just search it in Facebook. You'll find us. And or you can go to facebook.com/MG Wellness and the number 1 if you want to type that in. But just go in and search for MG Wellness. Follow the page, like the page, and then you will see all the events. And we would love it if you would join us next Wednesday night at 8 o'clock for our next Ask the Doctor. Hope you guys have a great night.
Bye-bye.
See you soon.